It's now 6:45 on this Wednesday. Well, sleep-related deaths affect more than 3,500 infants per year in the U.S. So how can parents prevent that from happening to their child? Well, in conjunction with West Tennessee Healthcare, here's Dr. David James with more in this week's Health Watch.
Meet Sandy Alexander. She was devastated when she received the news that her 12-week-old son Grant died from sudden infant death syndrome.
He was sleeping on his belly and in a pack and play with a big cushy blanket. It was warmer in the house. All these risk factors I just didn't pay attention to because you just kind of feel like that's never going to happen to me.
Sandy devotes a lot of her time in helping Tennessee educate other parents. She says SIDS prevention starts with one critical acronym.
Our new program is the ABCs of Safe Sleep, which is alone, on their back, and in a crib. And it's really easy to remember that acronym.
The ABCs simplify the process, but it's meant to be followed correctly.
That means no bumpers, pillows, blankets, toys, just your baby in a warm sleep sack. And that's just a wearable blanket. It zips up with the arms out.
Jackson General Hospital has been recognized by the National Safe Sleep Hospital Certification Program. It's a commitment to best practices for staff and parents, according to one executive.
We're doing everything we can to help them learn what is a safe sleep practice, and so that they can do that at home, because we want these babies to make it to that first birthday, and that first year is so important.
Other important tips to remember in SIDS prevention: avoid smoking during pregnancy and exposure to secondhand smoke after birth. Also, breastfeeding, which is associated with a reduced risk of SIDS, is recommended for at least the first 6 months of life. For this week's Health Watch, I'm Dr. David James.